Hold the device by cradling the white spring-loaded sleeve and blue collar in one hand. To allow for ease of entry, angle the hysteroscope slightly as it's introduced to the white base, which will expand to accommodate the hysteroscope diameter. The Omni Lok cervical seal grips the hysteroscope but does not lock on. Advance the Omni Lok cervical seal to the desired location on the scope based on user preference. At a minimum, the scope should protrude slightly from the distal end of the cervical seal prior to advancing the hysteroscope into the external os. The orientation of the Omni Lok cervical seal on the hysteroscope does not matter as long as the blue tab and white tab maintain their original configurations as packaged in the pouch. Do not twist or rotate the tabs with respect to each other. Once the Omni Lok cervical seal is seated, introduce the hysteroscope transvaginally under visualization. Insert the scope and Omni Lok cervical seal tip into the cervix, ensuring the cervical seal tip stays flush against the external os of the cervix. This creates a seal and minimizes leakage of distension media. Perform the hysteroscopic procedure following standard operating procedures. If required, you can extend the overall length of the cervical seal by changing the home configuration, as packaged in the pouch, to the extended position, which allows physicians to pull the hysteroscope back and maintain contact with the external os. Under visualization, hold the hysteroscope with one hand. Ensure that the white base is flush against the hysteroscope. Place a finger or thumb on the white tab of the base with the same hand that is holding the scope to secure it in place. With the other hand, push the blue tab on the blue collar forward until it locks into the extended position. To change the cervical seal from the extended position to the home position, hold the hysteroscope under visualization with one hand. Ensure the white base is flush against the hysteroscope. Place a finger or thumb on the white tab with the same hand that is holding the hysteroscope. With the other hand, grasp the blue tab and lift it over the step on the white base. Slide the blue tab to the home position until it is flush with the white base. It is important to never extend or retract the cervical seal using the white sleeve. Always use the tabs. At the end of the procedure, remove the hysteroscope and Omni Lok cervical seal from the patient as one unit by holding the blue collar and white sleeve during removal.